Feeling changes in your body can be unsettling, especially when they might indicate a potential stroke. But don't worry, you don't have to face this alone. In this video, we'll guide you through recognizing the 10 warning signs of a stroke, giving you crucial information that may help you notice these indicators about 30 days before a possible stroke might happen. Life can get very busy, making it easy to overlook important signals our bodies send us. We encourage you to take a moment, listen to your body, and become familiar with these signs. This video is an opportunity to learn about the early signs that could appear a month before a stroke. It's not just about taking care of your health, it's an act of self-care. Let's explore and share this video so that everyone can be aware of these important signs and lead a life of well-being and happiness. 1. High blood pressure. Having high blood pressure is a significant risk for having a stroke. HBP makes your heart work harder and can harm your arteries and organs as time goes on. Normal blood pressure is below 120/80. If your systolic pressure, the top number, is between 120 and 129, and your diastolic pressure, the bottom number, is less than 80, you have elevated blood pressure. High blood pressure is defined as a systolic pressure of 130 or higher, or a diastolic pressure of 80 or higher that remains consistently elevated over time. People with HBP are more likely to experience a stroke compared to those with normal blood pressure. About 87% of strokes happen because the blood vessels in the brain become narrow or blocked, cutting off the blood flow to brain cells. This is called an ischemic stroke. High blood pressure damages the inner lining of blood vessels, causing them to narrow. Around 13% of strokes occur when a blood vessel bursts in or near the brain, known as a hemorrhagic stroke. Chronic HBP or aging blood vessels are the main causes of this type of stroke. High blood pressure puts a strain on blood vessels, and over time, they may not withstand the pressure and can rupture. 2. Fatigue. Fatigue is not the same as regular tiredness because it doesn't seem to improve with rest. It can occur after any type of stroke, whether it's significant or minor. And it can also happen after a transient ischemic attack or mini-stroke. The signs of fatigue can differ among individuals, but you might feel a lack of energy or strength, constantly tired both physically and mentally. It can be mild or more severe, and it's not always a result of being more active or working harder. Sometimes you may need more rest or sleep than usual. Fatigue can make it challenging to participate in everyday activities and can impact your recovery and rehabilitation. If you suspect you're experiencing fatigue, it's a good idea to talk to your GP or therapist. They can help determine if something like medication or infection is causing the fatigue or if it's more likely related to the stroke. They may also suggest ways to manage your fatigue. Understanding the triggers for your fatigue and learning how to manage it is essential. Fatigue may improve over time, and you can enhance your recovery by seeking support and trying techniques to handle fatigue. 3. Sudden headaches. Sometimes it can be tricky to distinguish between a migraine and a headache related to a stroke. This is because they share some common symptoms, such as disorientation, a general feeling of being unwell, changes in vision, and vertigo. To tell them apart, pay attention to sensations. A migraine brings about sensations like auras, flashing lights, or tingling skin, while a stroke-related headache causes sensations to be lost, like a loss of vision or feeling. Moreover, migraine headaches have recognizable triggers, and the pain is described as a throbbing that gradually worsens. On the other hand, strokes can occur randomly, causing sudden and severe pain. A mini-stroke, formerly known as a transient ischemic attack, TIA, can also result in a stroke-related headache. A TIA involves a temporary interruption of blood flow, and unlike a stroke, The brain tissue only sustains temporary damage and recovers once blood flow is restored. Although TIA symptoms can last from 5 minutes to 24 hours, they are treated similarly to a stroke since they often serve as a warning sign. Seeking early treatment can prevent a stroke and potential permanent brain damage. 4. Vision problems. Vision loss on either the left or right side of your visual field can be a symptom of a transient ischemic attack. However, this often shows a type of vision loss that is not typical for a regular stroke. Usually, patients experience vision loss in one eye, where the eye initially seems to dim, as if seen through a frosted glass pane, followed by complete loss of vision. This reversible vision loss is known as transient monocular blindness, or TMB. Some reports also mention the surroundings appearing gray, objects looking blurry, and patients becoming sensitive to bright light. If you experience this or any other symptom associated with a stroke, like the loss of ability to move on one side of the body, difficulty speaking, or disorientation, seek immediate attention from a medical professional. Acting swiftly is crucial in mitigating the impact of a stroke. So if you notice these symptoms, don't leave it to chance. 5. Breathlessness or heart palpitations. If you're struggling to catch your breath or experiencing a rapid or fluttering heartbeat, it's important to consider the possibility of a stroke. This is particularly crucial if you already have heart or breathing issues. For instance, a study published in Sleep Medicine Reviews in April 2021 emphasized that sleep-disordered breathing is an independent risk factor for stroke. Moreover, the CDC has highlighted that having an irregular heartbeat can also elevate your risk of experiencing a stroke. 6. Numbness in limbs. If an individual experiences a stroke, they may suddenly feel numbness in the face or lose sensation in their hands, feet, arms, legs, or other extremities. This numbness can be accompanied by a tingling sensation. It's typical for a stroke to induce numbness on one side of the body, leaving the other side fully functional. When observing someone going through numbness, you might notice them frequently touching, massaging, or shaking the affected areas. These actions are often involuntary responses as the person tries to regain sensation or alleviate the discomfort caused by the numbness. If you observe these signs or suspect someone may be experiencing numbness due to a stroke, it's crucial to seek immediate medical attention. 7. Changes in smell. While changes in smell may not be a primary indicator of a stroke, there is a connection, given that strokes can affect individuals in diverse ways. An expert explains, stroke affects the brain and its functions, and of course, smell perception can be part of that. It's not a classic sign, but it's also not impossible that it would be in the mix of stroke effects. Typically, alterations in olfactory function occur as a result of a stroke, rather than serving as a warning sign. For instance, a study in BMC Neurology examined 78 participants who had experienced strokes and discovered that almost a third of them had a reduced ability to smell, and 15% had a complete loss of smell in the year following their strokes. Older participants tended to experience higher levels of impairment, partly due to age-related changes in smell, even without a stroke. Changes in smell can have a cascading effect on the overall quality of life. A study in Topics in Stroke Rehabilitation highlighted that olfactory issues can impact taste, subsequently putting stroke survivors at risk for malnutrition and depression. If you notice alterations in smell perception, particularly after a stroke, seeking medical attention is essential for comprehensive care. 8. Slurred speech. During a stroke on the left side of the brain, responsible for speech and language processing, There can be a sudden inability to speak or understand speech. It's also possible for someone to exhibit slurred speech if the muscles in the mouth and throat used for speaking are weakened due to a stroke. If you're with someone and suspect they might be having a stroke, you can ask them to repeat a simple sentence. If they struggle or if the words are unclear, it could be a sign of a stroke. Recognizing these speech-related signs is crucial for prompt medical attention, as it can significantly impact the outcome and recovery of the individual experiencing the stroke. 9. Hiccups. Persistent hiccups, although less common, can be an intriguing symptom of a stroke, particularly a small stroke in the brainstem. In cases of Wallenberg syndrome, which is associated with this type of brainstem stroke, individuals may also experience dizziness, nausea, vomiting, issues with balance, coordination problems on one side of the body, and sensory deficits. While hiccups may seem ordinary, their persistence, especially when accompanied by these other symptoms, could be indicative of a more significant health concern, requiring prompt medical attention to address the underlying issues and prevent potential complications. 10. Loss of balance or ataxia. Ataxia refers to a condition characterized by poor muscle control, leading to clumsy movements. It can result in difficulties with walking and maintaining balance. Additional indicators associated with ataxia encompass sudden feelings of dizziness and a loss of balance or coordination. This warning sign may manifest as early as a week or a month before an impending occurrence of stroke. If you find this video helpful, don't forget to give it a like, share, and subscribe for more health content like this.